Okay. So will you introduce yourself and tell a little bit about your background, such as where you went to college, your major, and your current employment?
My name is Jim Coates. I'm a licensed clinical social worker. I have a graduate degree in social work. I did my undergraduate work at Iowa State University in sociology. I took a master's degree in social work at the University of Iowa. I've worked for over 30 years in probably 10 agencies, so I don't know you want that whole list. This is a private practice in Carroll called Counseling Services. So that means that we don't work for anybody else, we work for ourselves. In Sac City, in Sac County, we're the mental health center there. So we have the mental health contract to provide services there. Here, private practice, there, the mental health center.
Right.
We've been here since about '07, and then my resume just goes back from there.
Yeah.
Okay?
Okay. So, as I said, I was doing the project on post-traumatic stress disorder, and I know that it's an anxiety disorder that develops in response to an event. Do you know what type of events trigger the post-traumatic stress disorder?
Well, the most common ones that people think about now are war.
Mm-hmm.
We're all hearing about young men and women that come back from Afghanistan, Iraq, places like that with PTSD, but also other situations that are highly traumatic. Sexual exploitation of a child, rape, going through very, very traumatic weather conditions, floods, things like that. Tornadoes can cause this kind of thing. Basically any event that's highly unusual and highly traumatic that causes feelings of helplessness, horror, and extreme fear about anything that can create that could be such an incident.
Mm-hmm. And do you know when it starts to occur? Like, you can tell that you have it? Like, how soon after the event do they come and actually get counseling?
Well, my information suggests that it usually takes a while for these symptoms to develop. I don't know a lot about that, but it's one incident can do something like this. A woman who's raped can have PTSD from one incident. But a lot of times it can be kind of an accrual of a lot of activities, like somebody in war who just sees ugliness day after day after day for too long of a time. Mm-hmm. And so the time, to tell you the truth, I'm not entirely sure when symptoms usually pop out, but I think it usually takes a little while.
Mm-hmm. And who can get it? Like, can any age, can children get it?
Children are the most susceptible.
Really?
The older you get, the more your mind is able to handle trauma. So an older adult faced with the same situation is less likely to get PTSD than a younger person. Children who are sexually exploited are at high risk for PTSD, depression, anxiety, all kinds of things. Does that make sense to you?
Yeah. Yes.
The younger you are, the more susceptible and prone you are.
And what are the symptoms of post-traumatic stress disorder?
Well, there's several things, but mostly it's intrusive, that is, recollections that you don't want, that keep coming back to you about the event or events that you experienced. And it can just simply be memories, it can be nightmares, but it can also be what people call flashbacks. Have you heard of that word? Flashback means like kind of a reliving of the experience, almost like you're right back to the event or events that caused this. Also, people try to numb themselves kind of so they don't feel this stuff, so they'll kind of try to numb themselves out, or they'll get like really hyper aroused, like in certain situations, very upset. So hyperarousal and kind of a numbness are two kind of features of this that are often seen.
And how do you help treat or counsel those with post-traumatic stress disorder?
Well, you've got to be careful. In my opinion, when you're dealing with people that have been through some pretty rough times, you've got to be careful to just dredge these things up over and over, because to me that can be almost like re-traumatizing. I think the most important thing, for me anyway, the most important thing is to just let people talk about what they want to talk about without forcing them to like relive things, stuff like that. The other thing is to help them figure out how to move forward with their lives. A lot of times people will, when they have these type of experiences, get really stuck. They just can't move forward with careers, jobs, relationships, whatever. And it's important to try to get a sense that you're moving forward with your life in some way that makes sense to you. So to me, that's a really big deal. Try to get people moving into what would seem to be a reasonable life for them.
How common is it? Do you get a lot of patients with this?
No. I mean, the answer, most people don't come to deal with issues of PTSD in a general counseling population. That doesn't mean they haven't had something. They may have had something that bothers them, but a lot of times they don't present with that. Do we have people that come in and just say, I'm really struggling because of you know, something that happened before? Yes, we do. But it's a relatively small part of our caseload here.
And do other disorders or illnesses go along with this? Like depression is one that comes to my mind too.
Of course. So there's this notion that the diagnostic manual, if you really want to learn about this stuff from the source, the DSM-4, you know what it is, DSM-5, read that. That's kind of the manual that we all use to figure out what these things are. But, you know, when you look at the book, it's just dozens and dozens and dozens of diagnoses, you know. It's like a Bible. It's huge. But the point is, these often commingle. What I mean is somebody who has anxiety may have depression, may easily have depression. Somebody with PTSD probably is depressed and also has a lot of anxiety. But they also have these recurrent recollections and thoughts that are kind of added on to it. So it's very unusual to see somebody who walks in with like one diagnosis and nothing else is flowing around them. But think of your own life. We all get bummed out, we all get worried, we all get this, we all get that. These are just symptoms that are exacerbated. They're just worse to the point where they're life stoppers or life slowers. Okay?
Okay, those are actually all the questions I have for you. So
there
thank
you have it. You're welcome.